Everybody, my name is Rebecca Medansky and I am a pelvic floor physical therapist and the owner of Ladybird PT, which is a clinic in Austin, Texas that specializes in helping people manage pregnancy pains, prepare for birth, and recover postpartum. And today I am here to talk about a common pelvic pain condition called vaginismus. We're going to be talking about what vaginismus is, we're going to be talking about why vaginismus occurs, and we're also going to be talking about what you can do about it. You do not have to live with vaginismus forever, and pelvic floor physical therapy can be so helpful. So let's start with what vaginismus is. Vaginismus is a condition that has been showing up in the media more and more. If you watch sex education, they talk about vaginismus in sex education, and anytime I see pelvic pain or any sort of pelvic health condition show up in the media, I do like a little happy dance. It thrills me. But it's a condition that more and more people are hearing about, I think, because the media is starting to cover it more. So what is it? Vaginismus is a condition where the pelvic floor muscles, specifically the muscles around the vaginal opening, involuntarily spasm, clench, close, turn on with any attempted penetration. So this can occur the first time somebody tries to put in a tampon. This can occur the first time somebody has an attempted gynecological exam, the first time somebody tries to insert a finger vaginally, an object, a penis vaginally. These muscles can involuntarily close and contract, leading people to feel like there's no opening, like they're hitting a wall. And it's also typically extremely painful because folks try to push through it. Now, vaginismus can also either occur from the very beginning when you first try to insert anything like a tampon, a finger, like I already talked about, or it can occur later in life after somebody's inserted a tampon, had a gynecological exam, had intercourse without pain, and then experiences some sort of pelvic floor injury or trauma, which then triggers that same involuntary muscle contraction prior to or with any attempted insertion. So what is it? It's an involuntary tensing of the pelvic floor muscles with any attempted insertion. Why does this happen? We're not really sure. There is a combination of reasons why this occurs, but it's some sort of involuntary muscle response. Now, once you learn that attempted penetration is painful, your body then intentionally prepares for that. So it's also this kind of fear pain cycle where the first time you attempt penetration, it hurts. The next time you attempt penetration, your body expects it to hurt, and so it prepares, right? Our body is meant to protect us from pain, and we expect pain to come on. We tend to clench and protect, and then in the case of vaginismus specifically, that can lead to this cycle where the pain continues. So why does it happen again? We're not really sure. There are a lot of potential theories. I have never read one clear explanation as to why this occurs, but we do know that it's not all that uncommon and that it is treatable. So how do we treat vaginismus? Vaginismus is treated with a combined approach of pelvic floor physical therapy, relaxation exercises, and home exercises that you can do on your own at home. And then there are components that we can draw on from medicine and from other medical solutions that can help. So PT starts by treating vaginismus with an initial evaluation where we're able to assess what's going on with these muscles. Are your muscles tight? Do we need to stretch them? Or are your muscles just reactive? And do we need to slowly desensitize your body? Your home exercise and PT can be a combination of exercises that you do in session and on your own at home to work on pelvic floor relaxation, and then manual therapy techniques or use of dilators or pelvic wands at home to help slowly stretch these muscles and desensitize them to larger objects. So sometimes people feel okay with a finger, but they don't feel okay with, say, a speculum or a larger toy or a penis. So treatment can also include this slow graded exposure component. And then if that's not enough, if you are experiencing so much pain with any sort of pelvic floor work, be it external, internal, we've tried everything, we're unable to slowly expand what you're able to tolerate in terms of insertion, there are suppositories for muscle relaxants. There is lidocaine lube. There are medical tools that we can bring on board to help pelvic floor physical therapy, to help the work that you're doing at home improve success overall, reduce pain. But people with vaginismus can absolutely return to pain-free sex, can absolutely return to pain-free gynecological exams, pain-free tampons, and if not return because you've never had that before, experience that in the future. This is a treatable condition. It is a multifactorial condition. Sometimes it requires that we bring on sex therapy. Sometimes it requires that we bring on, like I said, those medical tools, but oftentimes just addressing the musculoskeletal component with the physical therapist can help you figure out what the right path forward is to treating your pelvic pain and to having pain-free gynecological exams and pain-free pleasurable sex in the future as well. So if this sounds like you, if you feel like your muscles tense up, like there's no opening when you try to insert anything, any object, be it sexual or not, please keep in mind that vaginismus is a treatable condition. There's so much that we can do to help. But thank you for listening. If you have questions about vaginismus, drop them below. If you want more on this, let me know. I'm happy to make more videos on this topic and on the topic of pain with sex generally. And I hope that you have a great day.